and a few more people have joined. Right, so we might get started, even though a few more people might join. Welcome, everyone. Thank you for joining us this evening. Georgina and I have accidentally matched, as you can see. That was not deliberate. But it's lovely to have you here. I'm Kitty. I'm head of operations for the BDD Foundation, but tonight I'm here as someone with lived experience of BDD, sharing my experiences. And Georgina, would you like to introduce yourself?
Hi everyone, I'm Georgina Krebs. I'm an associate professor and clinical psychologist at University College London, and I have the pleasure of being a clinical advisor for the BDD Foundation as well. So I'm really pleased to be able to join this webinar this evening. Thank you all for joining.
Great, so I'm going to disappear for a bit and Georgina's going to share some slides.
I'll just check that my slides are sharing okay. Can you see those okay, Kitty?
Looks great.
Perfect. So in terms of the format for this webinar this evening, I've got a few slides that I'm going to talk through, and then I'm going to hand over to Kitty, who is going to probably say much more insightful things than I am. And then we've got a good chunk of time at the end for Q&A and discussion as well. But the topic for the webinar this evening is coping with lapses and relapses in BDD. So Kitty and I were both really keen to have this as a topic for the webinar series, because we both really recognise just how incredibly destabilising and demoralising setbacks in recovery can be. And I think that's really nicely illustrated by this quote from somebody who one of my colleagues at UCL was working with. And she said, "When I started to feel better and notice my progress, I was disappointed in the times when I felt I had regressed. I felt that I would never get better and all the progress would be futile, as everything would just revert back to what it used to be." And I've underlined those words, never get back, would never get better and all the progress would be futile, because I think that really captures the sense of helplessness and hopelessness that people often experience when they have a setback. And I think it's this helplessness and hopelessness that can be actually particularly toxic and almost the worst thing about a setback, because it often leads people to feel they may as well give up and want to withdraw. And of course, if you do withdraw and you do start to give up, then things can slip further. So actually, the biggest thing that I think I want to kind of communicate and I hope to achieve this evening is to take some of the fear out of setbacks and to help people feel empowered to manage setbacks if they do occur. So in terms of the overview of what I'm going to be talking about, I'll spend a bit of time talking about what I mean by lapses and relapses. I won't spend too long on definitions, but just these are slightly odd terms. So I'll just clarify what I mean when I'm talking about them. And then I'll talk about how common they are. I'll talk about what people can do to reduce their chance of relapse, and then also what to do if a relapse does occur. So what is a lapse and what is a relapse? I should say that within the kind of literature, there's no international kind of consensus on how these terms should be used or what they mean in the context of BDD. But when I'm using these terms this evening, when I talk about lapse, I'm talking about a kind of brief period of symptoms increasing after some phase of improvement or recovery. So this is a kind of flare-up that might last a week, it might last a couple of weeks, but it's relatively brief. And that's different to a relapse, which is more persistent. So again, it's a period, it's an experiencing return of symptoms after a period of improvement or recovery. But this return of symptoms is more persistent. So usually lasting for a month or longer. And at that point, we'd sort of call it a relapse. So how common are they? Well, lapses or little flare-ups, bumps in the road are really common. The road to recovery isn't a smooth one, it is bumpy, or if you put it another way, progress is rarely linear. If you think about kind of BDD symptoms starting up here and kind of reducing, they never reduce in a kind of straight line. It's always a wiggly line. People have sort of little lapses and setbacks and flare-ups, and that's shown in these two examples here. These are kind of real examples of people's BDD symptoms over a course of psychological therapy. So the scale on the side going upwards is the BDD severity score. And then across the bottom, you can see time. So for both of these people, you can see that overall, the kind of trend is that their symptoms are reducing with psychological therapy, and actually they're making really meaningful change. But these lines aren't straight, they're very wiggly, and they look different for the two different people. And actually, if you look at the person on the right-hand side in the kind of bluey purple line, you can see that at this point, they've been doing really well in treatment overall, but there are a couple of weeks where actually their symptoms really do increase quite substantially. And for that person, you can just imagine how that would feel over that 2-week period. If you only focus on the last 2 weeks, you would feel like, oh my goodness, things are getting so much worse. My BDD is really slipping, my symptoms are escalating. And so I think one of the things I want to emphasize with these kind of flare-ups and setbacks is that it's so important to kind of zoom out and see the bigger picture, because for this person, even at the end of that 2-week period, they're still not back at square one. They're still in quite, a considerably kind of stronger position than they were at the beginning of therapy. So I think zooming out and seeing the big picture is always really important. Think about where you've come from and also focus on where you're heading, because these setbacks really can just be temporary. So what about relapses? What does the research tell us? Well, relapses are also common, and that's one of the reasons that we wanted to talk about them this evening. But they're not experienced by everybody. And when you look at the research on kind of relapse in BDD, there haven't been a huge number of studies actually following people up for long periods of time. But the studies that have been done estimate that somewhere between 14 and 68% of people experience a relapse. And this is over a period of 8 years after treatment. That's a really big range, isn't it? 14 to 68%. So we don't know exactly, what the sort of best estimate is within that bracket. But I think the exact number doesn't actually matter. I think the key takeaway message here is that if you're feeling quite a bit better from your BDD and you haven't experienced a relapse, don't panic, don't worry. It's not an inevitability. A lot of people, as many, somewhere between maybe a third and up to 86% of people don't experience a relapse. So it's definitely not a kind of an inevitability for everybody. On the other hand, it is sensible to be realistic and consider that it is a possibility, because it does occur. And so by considering that possibility, you allow yourself to kind of be prepared and make a bit of a plan, which I'm going to come on to talking about. And I think the other key message I'd like to draw out from this research is that if you have experienced a relapse, it's so important to know that you're not alone. I think I've already mentioned how a relapse or a setback can make you feel sort of very demoralized and helpless and hopeless, but I think it can also sometimes bring with it a sense of failure. And I just really would like to kind of communicate and hopefully convince people that really it isn't about failure at all. And it's certainly kind of you're not alone if this is an experience you've had. So what can be done to reduce the chance of relapse? I'm going to talk through 5 different kind of strategies, I suppose, some of which are complementary. And the first thing is about anticipating triggers. So we know that relapses often occur in the context of stressful life events, and these can be quite general stressful life events like moving house or starting a new job. But actually, I think in the case of BDD, they're often stressful life events that somehow tap into your self-worth and your identity. So, for example, a breakdown of an important relationship can be a trigger for relapse. So, one kind of tool you can use to help reduce your chance of relapse is to think to yourself, are there any stressful events or transitions coming up in my life? And what kind of experiences would be most likely to trigger my BDD? It might be helpful to think whether certain experiences triggered the development of BDD in the first place. Not everyone does have that kind of experience. Some people, it comes a little bit out of the blue, but often people can identify particular life events or experiences that contributed to the development. And it might be that if similar experiences were to come about in the future, that they could trigger relapse. So the idea here is that by anticipating potential triggers, you know when to be kind of vigilant and on red alert to signs of symptoms increasing. And so that brings me on to the second strategy, which really is about identifying the kind of warning signs, identifying symptoms increasing as quickly as possible. Because, of course, if you can kind of spot a flare up quickly, it gives you that opportunity to try and nip things in the bud before they kind of escalate and take more of a hold. So you can ask yourself questions like, how would I know if BDD was getting worse? That might sound like a kind of a question that has a very obvious answer, but I think sometimes with BDD, when symptoms start to increase, it can be very, very gradual. Not always, but often it's quite gradual and kind of insidious. So it's hard to spot, day-to-day changes. The day-to-day changes might be quite minimal, but suddenly after 3 weeks, you realize that you're in quite a different place. So it's really helpful to sort of think about what thinking patterns might I have? Would there be certain kind of habits that I start to do more? Whether it's sort of checking my appearance more often or avoiding certain places. Would there be situations that I start to avoid altogether, like seeing friends or certain activities? How would I be feeling? Would I be feeling anxious? Would I be feeling low? Are there other emotions that I think are kind of warning signs of BDD for me? And really importantly, what would other people notice? So if there are other people who you're close to in your life, whether it's friends or family, would they notice anything different about you? And if so, could you kind of have this conversation with them and almost recruit them into your team to help you spot any early warning signs of BDD increasing? And then, of course, the point of being able to spot when BDD flare-ups occur is that you can then kind of act on it. So it's really important to have an action plan. And I'm sure it makes sense to people if I say that action plans are generally easier to make and generate when things are going well. Often we don't do that because when things are going well, we don't want to kind of think about, well, what if they're going less well? But actually, if a setback has occurred and you're starting to feel kind of demoralized and low, it's much harder at that point to kind of generate the kind of motivation or even the kind of confidence to build an action plan. So it's easier to kind of do it preemptively and to have it up your sleeve to deal with any setback that might occur. And when I say make an action plan, I think it's actually often really helpful to physically write it down, not just have it as something mental, but to have it written down as a kind of a document or on your phone, so that it's something really tangible. And the kind of things that you can think about in your action planner: what's helped you deal with BDD symptoms in the past? Are there certain tools or strategies that, either that you learned through therapy or just through trial and improvement that sort of helped you get on top of BDD symptoms or make positive changes in your life before? Would you be able to use them again? Is there anything that would interfere with you using them again? And is there support that you can draw on from other people? These could be friends or family, it could be therapists, or it could be the BDD Foundation or other people. And the general principle is that the sooner you act, the better. So it's this idea of kind of nipping things in the bud. The sooner you kind of spot a flare up in symptoms and the sooner you act on that, the better. So those three kind of strategies that I've talked about, so anticipating triggers, spotting return of symptoms and having an action plan, I always think of those as kind of defensive strategies. So what you can do to protect yourself if BDD symptoms are sort of increasing. But I think there are a couple of things you can do that are more, I guess, kind of proactive, like an offensive strategy to try and reduce chance of relapse. And I think the first of these is to really try and tackle any remaining symptoms. So even if you're in a phase where things feel better with BDD and you've made a lot of progress, try not to settle for that. Try and be ambitious and say to yourself, actually, I'm going to really try and tackle everything. And even if it doesn't feel like a problem in its own. So you might think, well, okay, I'm still avoiding a certain activity or going to certain places, and it's not really a big deal in and of itself. But you can think of this as being a little bit like a weed. If you kind of just chop it down so that it's not kind of particularly visible, but you leave the roots there, then there is a risk that that weed will grow back. Whereas if you really try and rip it out at the roots, and that's the same as kind of really tackling all the kind of fears and all of the worries and all of the habits, then it's much less likely to return. So again, you can kind of ask yourself questions like, are there still places that I avoid going because of my appearance concerns? Are there routines that I still do to try and check or cover up or change my appearance? And if yes, these are things that it's worth considering setting targets for and really trying to challenge them, almost as an insurance policy for the future. And then the last sort of strategy for preventing relapse that I wanted to mention is reclaiming life. So we all know that BDD gets in the way of life. It makes it feel like appearance is everything, and it makes it really difficult to do the things that you want to be doing and that you really value. And so I think when things are going better and when you've got to a place where you sort of feel like you're managing your BDD really well, it's really important not to leave space in your life for BDD to kind of come back in and fill it. And in other words, to kind of work on what we sometimes call reclaiming your life. So thinking about, are there things that you gave up because of BDD that you want to start again? Are there new ideas that you have, things that might give you a sense of pleasure and achievement and that would be good for your kind of mood and self-confidence? What are the things that I really value, that are really important to me in my life? What do I, in 10 years' time, when I look back, what do I want to have achieved? What's important? And so to kind of brainstorm some of these goals, and of course, they're not always things we can achieve overnight. So it's often important to kind of break them down into SMART goals, say sort of specific and measurable and so on. And reclaiming life isn't about, it's not just about kind of keeping busy for the sake of it. It also can have a really profound effect on kind of sense of self-worth. So you can think about this in the kind of self-esteem pie charts that I'm showing here. So Sarah, how she evaluated her self-worth when she had BDD. She felt like her self-worth was entirely or kind of largely tied up with her appearance, with a small portion kind of allocated to family and studies. But by broadening out her life and sort of engaging in more activities um, building more into her life, the section allocated to appearance became kind of smaller and smaller, and she started to kind of really recognize and value other characteristics in herself, which is, of course, really protective against BDD returning. So I just want to mention medication briefly as well, because this is important for thinking about relapse. And the NICE guidelines say that if you're taking a medication, an SSRI, and that's been helpful in treating your BDD, then it should be continued for at least 12 months to prevent relapse and allow for further improvements. And I don't think this is always communicated. So often I've had the experience of working with people who feel quite a bit better and think, oh, well, then it makes sense to stop my medication. But it's really important to know the rule of thumb is to continue for at least 6, if not 12 months, so that you can kind of really consolidate the progress you've made. And if you discontinue medication too quickly, you leave yourself a sort of a little bit vulnerable to things slipping back. And the NICE guidelines also say that if and when you do get to the point of stopping an SSRI medication, the dose should be reduced very gradually, and that should be done in discussion with a doctor who's monitoring things. So if you gradually reduce your dose by a little bit and you do notice symptoms flaring up slightly, then it's easy to kind of reverse and get back on track. So in the last few minutes, I'm just going to talk about what happens if a relapse does occur. So the main message here is just really don't panic. I know, as I've said, that it's a kind of very demoralizing, destabilizing experience. But the key thing is not to panic and remain optimistic. If you've had CBT before, then it's really worth considering top-up sessions. And it's really not the case of starting from scratch. So if you've had a course of CBT and responded to it and you experience a relapse, then actually what we usually find is that it's just a case of having a short course of CBT the second time around, a few booster sessions to get things back on track. And the NICE guidelines say that people who have had treatment and responded should, if they experience a relapse, they should be re-referred and seen quickly rather than placed on a routine wait list. So this isn't always implemented. The NICE guidelines say how things should be, not necessarily how they are. But it's worth knowing that, because if you do experience a relapse, you can kind of waive the NICE guidelines and say, well, I want to be seen quickly. If you haven't had therapy before and you experience a relapse, it is worth considering seeking a referral. Maybe now would be a good time. So, for example, you can self-refer to NHS talking therapies. This is what's formerly known as IAPT. And they're services that exist across the UK and offer treatment for BDD. It's also worth considering medication if that's something that you've had before and found helpful, or something that you haven't tried yet. And of course, seeking support from other sources, family and friends, the BDD Foundation, which, as I'm sure many of you know, runs fantastic support groups. But most of all, just do not lose hope and know that it is possible to get back on track. And not only that, often experiencing a relapse and getting back on track makes you stronger. And that's really nicely described, I think, in this quote. Bumps in the road are normal, and overcoming them however eventual, just showcases the incredible strength you possess and the hard work that you've put in. So I'm going to stop there and hand over to Kitty now. And then I think we'll have a little bit of time at the end for Q&A, but thank you very much.
Thank you so much, Georgina. Hopefully everyone will bear with me whilst I try and share my slides because I had some issues earlier, but fingers crossed it will work this time. 1 second, I just need to do a few bits here. How does that look, Georgina?
Oh yeah, now it's there. That's perfect. Brilliant.
Great. Thanks so much, and I'll see you in a bit, Georgina.
Thanks.
Right, so back to me. As I said before, I'm head of ops for the BDD Foundation, but I got into this position because of my lived experience of BDD, and that's what I will really focus on this evening. This webinar topic is particularly close to my heart because I did have a relapse in my late 20s, and that's what led me to get involved with the foundation. I'm also going to mention that I've had a bit of post-viral fatigue, so it can give me a bit of brain fog. So bear with me, but I'm hoping my adrenaline and my notes will carry me through. So I wanted to share about my experience of relapse. As you know, as Georgina mentioned in her presentation, it was a really scary time for me, and I felt particularly isolated when I went through it. But I will mention that, I don't have all the answers, and my experience won't necessarily reflect everyone's. But my hope is that by talking about what I went through, anyone watching this who's struggling will feel that there is hope and that you won't give up. I also want to note that there is a similarity in symptoms and thought patterns with BDD, but severity is on a spectrum. Comparison of appearance in BDD is common, but I also know that comparing our journeys is also really common. So for anyone listening who considers their experience of BDD as worse or simply different to mine, please know that although I'm only able to share from my personal experience, my role at the foundation has given me the privileged position of hearing from so many others who haven't felt able to share publicly, and I know that there are many different journeys. No matter how bad your BDD is right now, it is important to me that you know that you're not alone. There are others who have struggled similarly, and they have been able to reclaim their lives from BDD. I think I've gone on to the wrong slide. No, I haven't. It's fine. I won't spend too long giving my full history of BDD, but a bit of context might be helpful. I first started experiencing symptoms at around the age of 13, and these slowly got worse. Every day was a torment of anxiety, skin picking, makeup, and hair rituals that had me waking up very early to get ready for school and still being late, spending all my break times checking and redoing my hair and makeup. Eventually, I was struggling to leave the house, and my parents realized something was seriously wrong, but they didn't know what it was. My symptoms had got so bad that I didn't envisage a future for myself at that time. I'd even asked my brother if I'd be able to live with him once our parents had passed away, as I didn't think I'd ever be able to look after myself. Luckily, a family friend saw a BBC documentary on BDD and told my family about it. And that led to me at the age of 19 getting a diagnosis and starting CBT therapy. And it was the first time that I'd felt some hope. I spent several months receiving treatment, and during that time, I wasn't traveling on my gap year like most of my friends. I was just trying to make enough progress with my BDD that I could attend university. That was my goal at that point. And I did make good progress with the treatment. And although I had many lapses along the way, as recovery isn't linear, as Georgina showed with her clever graphs, I felt things were moving in the right direction. In hindsight, though, I did make a few mistakes from the start. And these are things I really wanted to share with you. Firstly, shame. Of course, there is shame around appearance with BDD, but my shame around having the mental health diagnosis of BDD meant that I saw recovery as an exercise or a piece of work to be completed. I had really high expectations of myself and felt that everyone else shared those same expectations of me, which meant that I wasn't as open with others as I could have been when I started to struggle again. The BDD was creeping back, but I felt I had to keep up appearances in every sense of the word and pretend I was coping when really I wasn't. And this then started the shoulds. I felt I should be over the BDD. I should be able to cope. I was far too tough on myself. The fear of not keeping up with my peers led me to push myself too far at times. I felt I had to perform just as well as my friends, which was mostly manageable at university, even if there were a few morning lectures missed. But when it came time to get a job, I didn't consider what would be a healthy choice, just what I felt I should do. And you'll notice that there were many shoulds that I imposed on myself. So I threw myself into a cutthroat fashion industry that ended up tearing my nerves to shreds. As soon as I started work, my BDD started to spike again, but I didn't listen to the warning signs. And here are some of the warning signs for me. Of course, they'll be different for everyone. So it's, as Georgina said, it can be helpful to think about what could be your warning signs. But for me, I started to wake in a state of panic every morning, fearful of the day. My preoccupation with my skin worsened, and it started to consume all of my thoughts again. I was waking earlier and earlier to get ready in order to just survive the day. Just before my full relapse, I was getting up at around 4 a.m. to get ready for work, then working a long, grueling day before coming home, collapsing in bed, only to do it all again the next day. My mirror checking went off the charts. At times, I was reaching for my handheld mirror every few minutes and going to check in the toilet mirrors as frequently as I could. I was very tearful, and although I was miraculously still performing well at work, I was racked with insecurities. I was pulling away from relationships and friendships as I had no energy beyond focusing on BDD rituals or my work. And as I was so busy with the work and the BDD, I'd also stopped seeing my therapist. Looking back, some of the work situations I was in were not acceptable, but my lack of confidence, which I attribute to my BDD and being young, meant that I put up with far more than I ever should have, and I waited far too long to reach out for more help. And that led to, what I call my big relapse. And that was when I was 27. I had a total burnout, physically and mentally. I knew I couldn't go on, and I broke down to my brother. I arranged to take a 4-month unpaid sabbatical from work. My aim was to refocus on BDD treatment and get my strength back up. It was the right decision, but in hindsight, taken a bit too late. I was too physically exhausted to engage in the therapy, and I was then diagnosed with glandular fever. In many ways, the glandular fever was a relief because I could retreat into my parents' home, and I felt I had, a good excuse to hide from the world. I could give up on pretending I had the energy to battle the BDD. But as I started to get a bit of physical recovery back and a bit of energy back the following year, a lot of that energy, unsurprisingly, went into my BDD. The anxiety was raging and as bad as I'd ever known it. At my worst, I spent around 5 months totally housebound. I was also diagnosed just before that with facial dermatitis, which exacerbated my symptoms. My 28th birthday was spent housebound, and I remember wondering how I had gone from an independent adult with a full-time job and a life. Well, I say a life, but actually, looking back, I wasn't doing much other than work, but I had a life, to a person unable to even go into the back garden and fully dependent on my parents for everything. My relapse was my lowest point with BDD, as I felt like a total failure. I mentioned at the start, I saw BDD recovery as an exercise to be completed, and in my mind, I'd failed. I'd had the specialist CBT treatment. Why wasn't I fully recovered? I put all of the blame on myself and felt incredibly isolated and embarrassed. Now I know that relapses are common with BDD, and it wasn't my failure. It was just that I was living with a very debilitating and insidious condition that needed more treatment. But back then, it was my lowest point, and it was also my scariest point. It's terrifying to feel like you're back to where you were at the start of BDD, or even worse than you were. It was the longest I'd spent not leaving the house. I felt like I was back to square one and all my recovery had gone out the window. But I will go on to explain why I was wrong about that. But at the time, what little confidence I had was shattered. Although I'm lucky to have a lovely group of friends and a supportive family, I feel they too were really shocked and scared by my sudden spiral downward. And I don't think they really knew what to do or how to help. I was very focused, understandably, on how I was feeling as I was so unwell, but I do know it was a very scary time for them too. And I think, for a lot of those months, I just wasn't motivated to re-engage in the exposure exercises or the CBT therapy. It just felt too much. And I didn't feel like I had the courage or the strength to try. But looking back, there were things that kept me going, even when I was stuck at home. And also some turning points. So I've popped them all in the pie chart, even though they're kind of two different things. But the three that kept me going, punctuating my day. For example, I'm not a sporty person. I have very little inclination for exercise. But I started following yoga tutorials online, just YouTube recorded ones. I would do that in the morning. I was rubbish at it. I still am, but there was something satisfying about following a routine. I took the time to make healthy meals for myself. I tried to learn about nutrition to restore my body and nurture physical health, even though I was at home. So what I would really encourage for anyone who is housebound right now, if you can, try to add any elements into your day that gives it some structure and some sense that you've completed something, however small. Like me, it could be a meal, it could be yoga, it could be learning something new, tidying your room, anything. But for me, it helped me do something other than just sit around and think about my BDD. It's so important to keep your mind busy because the BDD will take every minute if you let it. Therapy. So, I had a wonderful and very patient therapist, and having those weekly sessions were a lifeline for me, even though, at that point, there was no evidence that I was making any progress because, I wasn't in the CBT sense of it. And I didn't feel like I was being, a good client because I wasn't engaging in it. But for me, I was very depressed at the time, and just having that supportive and non-judgmental space each week was a blessing that I'll forever be grateful for. I know it's not possible for everyone to access, but if you can, I would really encourage it. Connection and community. I was very isolated at home. There were some very kind friends who called me regularly. And we spoke about all sorts of things, not just the BDD and my struggles. And it took me outside of the BDD thoughts and gave my brain some rest and some diversion. But I also know that maintaining friendships can be very difficult with BDD. And I know that's, doesn't always feel possible. If you can, I really encourage you to. reducing your isolation in any way you can is important. So if you don't feel able to contact a friend or you don't feel that you've got a secure friendship base, a really brave step is to join a support group, even if it's just to listen with your camera off. But I also know the bravery it takes to join. But I also have attended so many that I know what a wonderful space it can be. Really recommend it. So for me at the time, there actually weren't any online support groups when I was housebound, and I was yearning for a BDD community and to talk to people who understood. You know, as I said, it felt really scary, but I was tired of feeling like the only person in the world with these thoughts. I started to ask about the BDD Foundation and getting involved. It was even smaller back then than it is now. We're still very small. And I found out that the majority of funding came from memorial fundraisers. Learning more about this was the first time since my diagnosis that I felt lucky. Not lucky to have the condition. It always makes me upset when I get to this point. Okay. Not lucky to have the condition, but lucky to still be alive. Lucky that I still had a chance and lucky that I could start again. And this was a turning point to me trying again. So if you're listening to this, remember you have a chance and you can start again. No hole is too deep to climb out of. And with the right support and the right help, you can be pulled up again. So at this point, I regained some hope and I started to re-engage with the CBT and exposure aspect of the therapy. I started very small, just sitting up against the back step of my parents' garden from an angle that I thought no one could see me, but just sitting outside, even out of sight, felt threatening after not having left the house in so long. From there, I slowly built up, and interestingly, it moved much quicker than I expected, as the neural pathways that were created from my first CBT treatment and exposures were still there, and I gained momentum and much quicker than I expected. I hadn't been at square one like I feared, and what I'd learned through my first round of treatment hadn't disappeared. It just needed strengthening. Learning about the foundation really inspired me, and I thought about other things I could do from the confines of my room. I thought about fundraising that I could do from home and decided on creating charity Christmas cards. I hadn't fully thought this through though. As to get them printed, I had to go to the printers, so I had to leave the house. You know, back then you couldn't do this online. When I started to sell them, I had to make the trip to the post office or the post box. And, you know, slowly by slowly, I started to get out of the house more regularly. By the following year, I was attending the second BDD conference, the second one they'd ever held, not the second one I'd been to, and selling them there in person. By finding a cause that was important to me, that resonated with my deeper values, it pushed me to do things that I hadn't thought possible for a long time. So in terms of purpose, you know, I really encourage volunteering in any capacity for a cause that you care about. It was the best thing I did for my recovery, and that still holds true to get today. Public speaking is still scary for me, but the topic of this webinar was so important to me that it motivated me to speak regardless of fear. And finally, self-compassion. In connecting with others with BDD for the first time, I found a new community and a new outlook. Self-compassion was another light bulb moment for me. By meeting others I felt high empathy for, I realized that I too deserved that empathy. I wouldn't say the dreadful things to them that I was saying to myself, not just about my appearance, but also about my diagnosis and my relapse. The more stories I hear about BDD, the bigger my heart gets for our community. We all deserve the utmost compassion and understanding for the torment that BDD puts us through. It takes bravery every day. So please know that in just keeping going, just waking up every day, you're doing an incredible job. any steps beyond that challenge your BDD, even in the smallest ways, deserves huge celebration. No step is too small. In fact, I'd encourage you to start with the smallest step you can possibly think of and then build from there. The larger steps will come in time. We have some wonderful videos on self-compassion on our website. And my favourites are the two of Professor Paul Gilbert from the 2016 conference, which was the first conference I was well enough to attend. So slowly by slowly, I built back up, and in many ways, my relapse forced me to take my mental health more seriously. I prioritize my health and well-being as much as I can. I get boosted therapy sessions when I feel I need them. Has the path been smooth? Absolutely not. But I'm more compassionate to myself on the bad days or weeks, and that helps me move beyond them faster than before. And when we get cross with ourselves for having a blip or having a lapse, that's when we often start to spiral downwards. And by staying connected to the community, I've managed to reduce the shame that I held in having BDD. And even if I haven't totally overcome every aspect of the condition, I'm living a life that I never thought possible with a level of recovery that I thought impossible at one point. So please stay hopeful. Yeah, maintain hope, reach out for help, and keep going one step at a time. And Georgina, that's me.
Thank you so much, Kitty. I think it's yeah, incredibly powerful hearing about your experience, and I'm sure instilling so much hope. It's really inspirational. Yeah, thank you.
Okay, sorry for crying. Well, it didn't go full crying, but I got a bit caught at one point. But I think
But
that's what it
it's
does.
real. Yeah, exactly. No, I think yeah, it's just incredibly kind of you to share what is a very kind of personal experience. So thank you. I know there are a couple of questions or a couple of comments in the chat. Should we go to those in the
Yeah.
Q&A?
And if anyone else wants to put anything in there.
Well, one is a question about the difference between a lapse and a relapse, which I kind of went over quite quickly at the beginning, but I think I said different people have different definitions, so there's no kind of particular consensus on agreement on what these terms mean. When I talk about lapse, I think of it as being a kind of more temporary flare up. So it might be something that's a few days, a few weeks even, but a kind of little blip along the way. Whereas a relapse is something that might be more extreme, but it's also more persistent. So it doesn't just sort of, you don't get back on track after a couple of weeks. It's actually kind of really taken a hold and hard to sort of see a way out of. I don't know, Kitty, if that kind of resonates with how you would think of them.
Yeah, totally. And I think most people with BDD will recognize, I refer to it as a blip or lapse, a time where your symptoms flare up. And I mean, one of my lapses before my relapse, I was unwell I didn't leave the house for a week. And that for me was like a big shock and I wasn't expecting it. But I, you know, went back on SSRIs and I, got moving again very, very quickly. And it was a while before I actually had my full-on relapse. And, as I said now, the road isn't always smooth. There might be some days here and there that I have a flare-up of symptoms, not necessarily that I'm not leaving the house, thankfully, but I'll have a flare-up of anxiety and I'll have some of those intrusive thoughts, those, same worries and compulsions to check the mirror. And, I'm able to notice them and get back on track quicker. But the relapse for me was just, as I said, it for me, it was a big one. But I know everyone else's experience will be slightly different, but that was a lengthy one for me.
Yeah, that makes sense. Yeah, and I think it's hard to imagine there would be anyone who hasn't experienced a lapse or flare up. I just feel like that it would kind of be impossible to have, yeah, that kind of linear improvement where things just get better and better and better day on day, because that's not how life works. There are also always going to be good days and bad days, and some of those bad days are quite kind of powerful, and sometimes they're bad 2 days or 3 days or 4 days. But yeah, the lapses, I think, probably is something that everyone can relate to. Relapses are something that are probably a terrifying prospect for everyone, but yeah, as I said, not an inevitability. And it's good to be optimistic, but also they are common, so it's important to kind of be, I guess, realistic, and also to know that if you've experienced one, take away some of that blame that you talked about, the kind of self-blame and the feeling of failure, that you were able to kind of reframe that and say, no, this is just the condition, this is just the nature of BDD. It's not my fault. And I imagine that's quite a helpful shift in thinking.
Hugely, but it took me a long time to make that shift. I did feel like a failure for quite a long time before I realized that. And I think that's why this webinar was so important to me, because if anyone else can reach that point quicker than I did, I will be happy, because it isn't your fault. It's not something you've done wrong. There are lots of life circumstances that can trigger relapse. We can do everything right sometimes. I spoke about ignoring lots of warning signs, and that led to my relapse. But life is long.
Mm,
Things happen, but all we can do is, when stuff goes wrong, is be kind to ourselves
mm.
and know that we can get back on track, which is something I really believe now. I just didn't believe it then, and there weren't enough people talking about it. So
Yeah,
that's hoping to talk tonight.
exactly. Um, I can see a couple more comments. So one is from a mother, or parent, I'm not sure, mother or father, of a 22-year-old who's had BDD since she was 16. And it made some progress, but things seem to kind of flare up every month before her period. And the questions about the best way of supporting a family member when you can see them spiraling and checking habits are escalating, things can get very tense. That's a really, yeah, good question, and a really nice comment as well. Thank you, Kitty, for her experience. Yeah, Kitty, I don't know if you have any thoughts from
I
your
have,
own experience of what would have helped.
well, I think it's really tricky, isn't it? Because if you're not well, you're not really yourself. And that's another thing. For many years, I thought that BDD was my personality. I didn't have the diagnosis. It was just all encompassing. And when you're ill, and when the BDD's taken over, sometimes it can be hard to give advice on what's best to help, because almost everything's annoying. Um,
Mm,
Say if it's around that time of the month, that might even be exacerbated. Um, I I think it's really tricky, because you say that, when you see them spiraling and the checking habits escalating, and I'm assuming that things get tense when you try and step in and encourage them to reduce those habits. Um, and I think it's hard, because if someone stood in the way of some of my compulsions when I was really ill, I would get quite angry, because it's the anxiety. I didn't want to be angry. I'm not, well, it depends who you ask, but I don't think I'm a particularly angry person. But it would bring out my anger. I think maybe not intervening when they're right in the middle of the compulsions, and maybe waiting till a quieter moment and say, I noticed that you're really, really struggling. How best can I support you in those moments, and hear what she might find supportive. But when you're in the midst of it, it's really hard to think clearly, and any intervention sometimes doesn't land. So it's not always your fault. Georgina, I know that you used to work in the specialist unit for young people, so you might have some better tips as well.
I completely agree with what you've said, that I think in those moments it's kind of almost impossible to kind of have any kind of rational conversation or to kind of have a productive conversation even. So I think I agree with you, Kitty. It's about kind of waiting for the kind of calmer, they may not be completely calm, but the relatively calm moments, and particularly um, for this person, if she has a bit of a kind of monthly cycle, a pattern with her symptoms flaring up, then perhaps it's sort of choosing the couple of weeks where things are relatively better and actually having a conversation, reflecting. I don't know whether she notices that pattern herself as well, whether she's aware of it, but reflecting your observation back to her and sort of trying to have a conversation where you can feel like you're on the same side, not kind of on opposite teams, but talking about what you could do, what you might be able to do to help, but also are there other resources you can draw on kind of from professionals or therapy to help. And I can see that there's another comment which I think is not necessarily specifically about relapse, but from somebody who's having a really kind of horrible time with BDD, and it sounds like a really, really difficult situation to be in. And as Kitty said, that there's no sort of easy or quick fix, but there really is hope. I guess that's the main thing I'd want to say. And there are sources of support out there. Kitty, I don't know if you want to comment on that.
There's something that stands out to me, and it's this person commenting on their age. And I think it's really difficult when, when BDD is spoken about, often we talk about people who are younger, because the onset of symptoms is generally in teenage years. But I know from the foundation we have people of all ages joining our support groups, people in their 70s. There's no age, and actually David Veal said this in one of the webinars earlier in the series. There's no age that is too old to get help, get treatment. And I think I mentioned that one of the pressures I put myself was keeping up with my peers and feeling like I had to hit certain milestones. And the reality is that, we all have different paths in life and different timings. So don't feel that, it's too late for you. There's lots of ways to get help and support. And, I'd really encourage reaching out to our email helpline as a starter, which is support@bddfoundation.org. You've mentioned about not having any friends. And I think I mentioned that in my, when I was going through my slides. I know it's really, really tough. When you're not going out the house, it's really hard to make friends or maintain friendships. But there's some wonderful people in this community. And, hopefully they might create, a feeling of friendship for you that can develop over time. So, there are online support groups. You don't have to put on your video. You don't even have to speak, but, it can be a start. So yeah, I feel like I'm waffling on, but I hope that yeah.
It's really
Awesome.
helpful. Yeah. And I think I can see that Jem's also put the email helpline in the chat, which may also be relevant for the final question or comment about a sort of CBT therapist in Northern Ireland specifically. So reaching out via that helpline might be a useful starting point. I mean, there are a lot of therapists now who it depends whether you're wanting to sort of go down a private route or not, but there are a lot of therapists who deliver CBT remotely now, which can have pros and cons, and that's probably a whole topic of conversation in itself, but it can be really effective. So even if there isn't a specialist therapist kind of locally, that's another option to consider.
And I think there was just one more, which was someone who they've needed to start wearing hearing aids, which is I think I can say understandably because as someone with BDD, I understand that any changes to appearance can be really triggering, particularly if it's a sudden one. Um, it's bringing back the same thoughts that you had from before, and you felt that you can't wear the hearing aids as a result. I mean, Georgina, is there anything that you'd like to say to that from a clinical perspective?
Yeah, well, I suppose it was just making me think about the point you made during your presentation, Kitty, about how even when things feel impossible, sometimes just the tiniest step can lead to really big changes and often more rapidly than you thought. You gave the example of just sitting on the back step outside your house. And so I just wonder if there might be a parallel here, that I can completely understand the position and how difficult this must be. But I wonder if there's a way of sort of trying to take a really small step towards introducing wearing the hearing aids and just kind of testing out what that's like and gradually building confidence.
Mm. Yeah, I was thinking the same thing. And I was thinking maybe, I don't know if you need to wear them when you're in the house, but maybe getting used to them in the home setting first and then setting really small little goals. Maybe it's seeing someone that you feel safe with to start off with and building up. Um, it's really difficult, but I think it's taking those steps and facing those fears and reminding yourself when those thoughts come in. I have to remind myself, when I get those BDD thoughts, these are just a thought, they're not a fact. And just because I've thought it doesn't mean that other people are thinking it. And I also remind myself, because I know that, we're not immune to having comments about our appearance, unfortunately. I wish we were in a world where people never made comments, but they do. But now I tell myself, okay, what does it say about that person if they're making that comment rather than what does it say about me? Because often the people who are making those comments aren't coming from a place where they feel particularly happy. And yeah, what does it say about them? I don't think it says anything about you. So that's what I try and remember. I think that's I think that's it for the questions.
Brilliant. And
And we
we're sort of just over 8 o'clock, so I suppose we should finish there. But thank you so much to everybody for joining.
Yes, thank you everyone for joining. And yes, please remember to reach out to the BDD Foundation via the helpline and check out all of the resources because there are some really great things in there. And you're not alone. And there's a whole community of us ready to welcome and embrace you. So yeah, have a lovely evening.
Bye, everybody.